Now inside the State House, the Illinois Association of the Agencies on Aging says they might lose critical funding from the federal government. The federal government supplies Illinois $53 million through the Older Americans Act, which is meant to address the needs of the elderly. Fox Illinois' Emily Jordan is breaking down what those services are. Emily?
Agencies like AgeLink, the Area Agency on Aging for Lincoln Land, use federal funds and community donations to direct services like transportation, home delivery for meals, and support of caregivers for those elderly individuals. They say through their family caregiver support programs, they're minimizing stress, citing data that 1 in 5 Americans provide unpaid care to an adult with health or functional needs. They say their services keep care centered at the home.
We are trying to help seniors maintain their dignity and live independently for as long as possible in their own homes. Nobody wants to have to leave their home and go to a facility, and definitely not before they would, it would become absolutely necessary.
Carolyn Austin, the CEO for AgeLink, says without federal funding, they worry some programs could be cut completely, including their senior health insurance program, which helps seniors sign up for prescription drug plans. Reporting live in Springfield, I'm Emily Jordan. Back to you.
Thank you, Emily. The Illinois Association of Area Agencies on Aging plan to host a statewide day of action on May 28th to call for lawmakers to fund the Older Americans Act. And inside the State House, Illinois Agencies on Aging are ringing the alarm bell when it comes to federal support for aging Americans. As the Department of Government Efficiency makes sweeping cuts throughout the nation, though the cuts haven't reached Illinois yet, they say some of their agencies have already seen the funding process slow down. Fox Illinois' Emily Jordan was at the Capitol this morning, and she shares an update. Emily?
The Older Americans Act is meant to address the needs of the elderly, from meal delivery to abuse prevention. But now agencies worry those services won't last after the end of this fiscal year. Illinois' Area Agencies on Aging say the Department of Health and Human Services cut half of the staff responsible for implementing the Older Americans Act and its funding in early April. Diane Slazek, the president and CEO of Age Options, says the act gives Illinois $53 million, which she says went towards serving almost 500,000 seniors in the state last year.
Today we send a clear message to you. We will not allow these vital services to be diminished or denied to older adults in Illinois. In the past, those programs have worked together under a single administrative framework rather than being fragmented across several federal agencies.
Carolyn Austin, the CEO of AgeLink, says some of those services in central Illinois include home delivery of meals, support for caregivers, and transportation.
These programs are not wasteful. These programs are helping our seniors stay in their homes for as long as possible. So we really want to make sure that we have the funds to support the need. In the last year, I would say calls and walk-ins at our agency alone have increased by probably 50%.
Austin says many of these programs have matched donations from the community, but losing federal funding would be a significant blow.
There's no way that they can do those meals, and people would have to do without. Some of these seniors only get $700 or $800 a month to cover rent and utilities and medications and things like that.
According to the Illinois Association of Area Agencies on Aging, 11 million meals were served to over 75,000 older adults statewide in 2023. I'm Emily Jordan. Back to you.
Thank you, Emily. The Illinois Association of Area Agencies on Aging plan to host a statewide day of action on May 28th to call for lawmakers to fund the Older Americans Act. Thank you for watching. Make sure you subscribe to our YouTube channel and be sure to watch more videos from Fox Illinois.